Hello, my name's Carly Dennison. I'm doing delegation and conflict management. So conflict. The initial conflict is a physician orders a secondary lab for a patient that is not addressed during the day shift. At shift change, which I come on at 7 p.m. at night, I receive report from a day shift RN with no explanation for holding secondary lab draw. So in this particular situation, the physician approaches the night shift RN abruptly and demands lab work to be drawn as soon as possible. During shift change, you get your initial report of your 4 patients that you're going to receive for the evening. So the RN explains the situation briefly. Due to overwhelming critical patient assignments, given at shift change, labs will be drawn by another RN in order for it to be done promptly. ER physician states it's your responsibility to get the lab work drawn and sent with no exceptions. So with that being said, the steps of the conflict management. So identifying the actual conflict, your secondary lab work not complete in an efficient manner from day shift, looking beyond the incident, understanding that timely return of lab work can save a patient's life is ultimately the tool for a physician to diagnose and further the patient's care. Requesting solutions. By actively listening to the physician's concerns, offering the solutions, and delegating the task to another RN is acceptable because it will actually affect that patient in a positive manner. With a critical assignment that's given to that night shift RN, it would not be feasible to have her tasked with that at that time. Agreement. Although the physician can need to voice his opinion in an aggravated manner, the RN directed the attention and proceeded to accomplish the task. So that RN was able to minimize the conflict at hand, basically is what she did. So negotiation. As an RN, I would negotiate the facts versus perception prior to the conflict, acknowledge and reassure completion of tasks during the conflict, and confirm plan of completion after the conflict. It helps both parties understand the situation as a whole versus one side versus the other. We're there as a team. You're supposed to pursue the patient care as a team and accomplish what needs to be done. So destructive techniques. Avoiding the conflict will only intensify the argument and portray negligence on the RN part. So if you're avoiding the conflict and you don't address the situation at hand, possibly the patient could suffer. And not only does that take place, but the RN suffers down the road because they do not address the problem at hand. And it could only get worse between the RN and that physician. Competing in conflict will also intensify the argument because there will not be acknowledgement of the problem itself and just presenting each party points with no resolution. So in other words, if you're going back and forth about who's right, who's wrong, really doesn't get you where you need to be to accomplish that task appropriately. So working together as a team is imperative to have the patient care done appropriately. Accommodating can be the other end of the spectrum. So because the RN has a critical assignment that the physician may not realize, the importance of prioritizing at that very moment. So in other words, accommodating, the physician can actually put the other patients that that nurse is in charge of at risk. So it is that nurse's obligation to make sure that she delegates the appropriate way to the RN or to a paramedic to get those tasks completed so that all of her patients are well taken care of. So delegation. As an RN, delegation of a task to a paramedic within the ER setting is common due to the quick turnover of patients. When a critical assignment is given at shift change, delegation is imperative in order to stay on task. So in other words, if an RN comes in and overwhelmed with patient medications, patient procedures, it is due that RN needs to assign the paramedic a task that is within their scope of practice. So in other words, like a normal shift, a paramedic may get delegated IV and lab, which means they start the IV, get the lab work done, and taken to the lab, blood work. So then an EKG, hooking them up to the monitor, the basic workup of a patient that comes into the emergency room. So on an AFib patient, it's very imperative that that nurse stays at bedside at the whole time, unless having to pull medications. So that RN will have to have that paramedic while she goes and gets medications. We'll be doing the EKG, hooking them to the monitor, getting the blood work. So somebody's at bedside the whole time. when defining the 5 rights for each task. So you want to make sure you have the right task. The organization, policies, and procedures define the standards and the limitations for delegating tasks. The right circumstances, assessing the patient needs and level of care needed. Prioritize delegate is imperative. Right person, educational training and requirements with competency of nurses and UAPs. So having that right person is imperative. If you have 4 patients, having the same last name is kind of it's a red flag. You want to make sure that you are doing taking care of the right patient and doing the right procedures on the right patient. So right direction and communication. You want to communicate acceptable activities and standard of care through role descriptions and policies and procedures. You should know what your policies and procedures are within your facility so that you are able to take care of that patient to the best of your ability and stay within your scope of practice. Your right supervision and evaluation. Supervision should be done by the RN and follow the expected method of supervision. So having that in mind, you want to make sure that when you have a paramedic doing a task that you have assigned them, it's within their scope of practice, and that if they have any questions, that you can be there to answer them or to assist them with a procedure at hand. The 5 rights of delegation. So your right task. IV lab, EKG can be delegated per policy and procedure. Your right circumstances. The equipment is available at bedside and allows RN to stay at bedside to monitor patient. That's a very important thing to have for those patients that are critical. Your right person. The paramedic is qualified, certified for the tasks given. Right direction and communication. RN explains expectations completely and efficiently with understanding from paramedic. So that paramedic needs to understand what they're being tasked, and from start to finish to make sure that it's done correctly. Right supervision and evaluation. By utilizing bedside treatment from RN, the patient receives monitoring and undivided attention from personnel. So if the paramedic is doing their work and the RN is documenting, you have 2 people there at bedside able to monitor the patient through their crises. Some delegation errors. So not knowing your state regulations or facility procedures on delegation. That can be a pretty important thing. Legalities of doing the wrong procedure that is not in your scope of practice, or doing it the improper way, can cause a patient's life. And they take that very serious. So just make sure that you know your state regulations and the facility procedures so that you don't fall into that rut. Failure to assess your patient prior to delegation. You need to make sure that you assess your patient prior to any kind of procedure. For instance, like if you're going to start IV in lab, or if you're going to administer fluids, or if you're going to do medications, you want to make sure that you get the blood pressure, your baseline vital signs. What is the overall appearance of the patient? Is there something else going on that may stop you from doing what your initial plan of care is supposed to be? You just want to make sure that you don't create a spiral effect for that patient. Failure to know the delegate's ability and willingness to do an efficient job. So you need to make sure that you know what your paramedics are capable of doing. Just because they have a degree and just because they have the education does not mean that they're best suited for that procedure. Just make sure that for your certain patient, that helper is the best. We're going to go over some definitions. So a healthy work environment, positive environment that is safe, clean, and organized. It minimizes the overall anxiety and stress that can be created by his or her surroundings. Coming into a facility, this goes for patients, for staff, for management. When they come in, if the place is a disaster, dirty, stretchers not clean and all over the hallway, it just creates an environment of instability and just sloppiness, basically. And that is not how we want to present our ER. The components of a healthy work environment revolve around the efforts of the company to look after their staff. Employees who feel that they are cared for and looked after will have better teamwork, increased productivity, reduction in sick leave, and overall workplace accidents. This holds very true. We have huddles every morning, and we have huddles at the beginning of our shift. So with that being said, that we have people who are constantly there who are, if we have questions, if we have concerns, and they ask you, is there any positive, discussion that we need? Is there anything that we need to put light on to fix? And that is imperative for our nursing staff. My current work environment is clean, organized, and free from clutter. This alone helps me stay focused on my tasks, and by not spending my time straightening the area after other people. So coming into a clean work environment and maintaining that environment allows for the patients to feel like they're in a clutter-free zone. Well, for safety measures, for just a general impression of the facility, all those things matter. There are no current issues for my facility that I see at this time. The way I see it is that, when I come in and I see that everybody works as a team and we work together to make sure that when rooms are dirty, it doesn't matter if you're a nurse, a paramedic, a receptionist, we're all working towards the same goal. So we help each other out, and that makes for a better, smoother working environment. An effective leader must listen to the concerns of the staff and support the team and their needs. It is also imperative to keep the staff informed of changes and updates within their facility or immediate workspace. The leadership must also spend time on all shifts to show their support and concern for the well-being of the overall staff. So, with this being said, it is important for the management staff, even the educational staff, to appear on night shift. I know that, most people work 8 to 5 that are, doing educational or management. But the reality of it is that you need to have them available for all shifts. Mid shifts, night shifts, day shifts, it doesn't matter. That way you can show your support for all of your staff members. And that is it for my presentation. I hope you enjoyed it, and have a great night. Thank you.